if you can do nothing else other than wash your face, brush your teeth, wear sunscreen. Like that's a non-negotiable. Every day, I don't care if it's raining, I don't care if it's winter, doesn't matter.
Right.
So if you must, and you're like, oh, I can't, whatever, pick a tinted one so that it's part of your routine. So that's the first non-negotiable for me.
Welcome to Faded to Fabulous, the podcast for women who know that midlife is not the end. It's the beginning of something bold. I'm Kim Lovely, and I'm here with Vicki Kirby. We're here to talk to you about health, hormones, confidence, and joy. Midlife isn't about fading away. It's about stepping into your power and shining brighter than ever. Let's get into it.
Welcome, ladies. We're excited to have you back, and we're excited because we have a friend with us today. And we're going to talk, I love the title of today, Aging with Intention. Let's talk skincare and enhancements, because I think there's a lot of challenges that we face in midlife, and, keeping up with our appearances is part of that as we age. And I think that there's, all sorts of schools of thought, right?
Yes.
We've got the gracefully aging, like growing out my grays, which I have so many queens in my life that are doing that. They look great. And then there's, the other camp that's like, please inject it, cut it, dissect it, like, do all the things to
Dye it, pluck it.
pluck it, paint it, like whatever you want to do. And
Yeah.
then I think a lot of us kind of fall in the middle.
Yeah, so I think one of the things too is we want to sort of take some of the stigma off of it, right?
Yeah.
That it's not, people should be allowed to do whatever they feel is right. When we were talking about it, like introducing this topic, I personally want my exterior to reflect how I feel inside, right?
Yeah.
So I'm 60, but I don't feel 60. And so I'm looking to have, be consistent, look the way I feel inside.
Right.
So, yeah. So Meghan, this is Meghan McCarthy.
Hi.
She is a registered nurse, and she has come to talk to us about all things women and beauty and aging with intention. She is the owner of Refined Beauty Med Spa in Nashua, New Hampshire, of which Vicki and I are happy to be clients.
Don't tell.
See, there's that stigma.
I'm
Right?
to tell you. You can see my forehead is not moving very much because I had a lovely visit with her recently.
You know what's so funny? Do you know what got me to you the very first time? I was in a video with Dominique in Greece, and I'm having this wonderful conversation and being filmed. I had the most angry 11s in the middle of my forehead, and I'm like, oh my goodness, Kim Lovely.
And
I'm not an angry person.
Right.
That's not me, but my face looked like I was, I don't know, constipated or angry or something, right? So I'm like, we got to do something about that. So I came to find Meghan.
Well, I'm glad you did.
Yes. So Meghan, tell us a little bit about you. How did you get to where you are now?
Sure. Yeah. So I've been a nurse for basically my whole life, since I started working. And most of it was in the emergency department at Beth Israel Deaconess in Boston. And after about 20 years or so.
Close to your mic. Sorry.
Oh, yeah, no
There we
worries.
go.
After about 20 years or so of working in the ED in Boston, I loved what I started out doing. It just took a turn. It was time. And I knew that. And I didn't know what my exit strategy was going to be. So when I was about 40, though, I'd had my second child, my daughter. And I went looking for something to make me feel a little younger. You look a little rough after childbirth or whatever. You feel a little older, a little tired. So I went to a med spa and I was like, hey, what can I do about this? And just a little Botox maybe or something. And I ended up actually working at that med spa. And I worked there for probably 8 years or so. And that's where I met Vicki. She was working there as well, doing some charting and stuff for us. So that's where I started. I did that for a while. And then after COVID and, the whole whatever things that happened then, I knew something had to change again. And I said, my husband has always been my biggest cheerleader. And he's like, you could be doing this for yourself. You could do this for yourself. And I was like, I'm a nurse. I'm not a business person. I don't know how to do that. And
We know that story.
Yeah, and it's a big leap, when you think you just stay in your lane. But he pushed me. He's my business guy or whatever. And so then in January of 2021, I opened Refined Beauty. And so we're coming up on 5 years. Yeah, so it's been
very good.
It's been the best thing I could have done for myself in terms of life-work balance and all that stuff. But also just being able to make the decisions in terms of the treatments that I offer and the way that I offer them without having to answer to anybody else.
On that note, which is I think is really, really interesting, and I'm afraid I'm going to forget to tell her this afterwards. I showed my husband the video that we did in your office, and he said, she's really smart. She really explains things really, really well. And
That
I
I
said,
can
right?
do.
Yeah. So
explain stuff.
that came out like really clearly, which I thought was,
thank you.
I will. Yeah, I will.
And I actually make a point of that to try. And even when I was in the ED, I made a point of trying to explain things to people in a way that it sort of parses down that medicalese into tangible little bits of information that they can understand. And then I do the same thing with aesthetics. I use a lot of analogies and stuff that just, makes it easier for them to understand. Because when it is easier to understand, that sort of that stigma and that fear go away.
Absolutely.
Yeah.
What do you love most about what you do?
I think just being able to give women that confidence back that they may have been lacking, whether it's something as subtle as, and there are studies to back this up, that a little bit of Botox or whatever you want to, I'll get into that later, but just a little tweak here and there makes you feel better. And if you feel better, you perform better.
You show up better.
You show up better.
Yeah.
And so just giving them that, whether it's just that or maybe just, they've been dealing with acne scars or a very weak chin or just there's a number of different things, but giving them back that bolster of confidence that they need to help them succeed in all the other areas of their life I'm not saving lives, but I'm improving them is what I always say now.
I love that. I love that.
That's
I like
cool.
that a lot.
Fantastic.
Kim, one of the things that you said, which was interesting, because I think we had talked about Botox and you were before you even had it.
Yeah.
And we were talking about like, when should you start?
Yeah.
And you said something funny, which was you wish you had started
I wish I had
sooner.
started sooner. Yeah. I wasn't opposed to it. I didn't think.
This wasn't on your radar.
Yeah, I didn't think badly of people that did or didn't. Like I certainly didn't
Neutral
judge,
about it,
right?
yeah.
But I think sometimes maybe we just get busy and there's 12 million things that we're already doing. I mean, taking care of these human forms as we're aging is a lot of work, right?
Yes, it's a lot
And so
into it.
maybe in my mind I was like, oh my goodness, one more thing to keep up with. But but it did take that video. And to be honest, that video that I saw myself on, that was viewed by millions of people.
Yeah.
So it was kind of like, okay,
What a
Kim
redo.
Lovely, like we need to do this. And I will say too, my brother does the work that you do. So he was always sort of saying, hey,
Hey, I got you something for Christmas.
you should consider it before it becomes really, really indented, right? Because it'll make a really deep. And so, interesting too, because he'll always sort of ask me when I've had some stuff done. And he was like, so what did you say? What did you do? And I said, because he told me, he's like, be careful of your cheeks. They're perfect.
Yeah.
And when I went in, I'm like, I love my cheeks. We're good.
Yep.
And you were like, yep, they are perfect. So you're always like bang on with my brother. Just great.
That's good. He shows moderation. So you have dynamic lines and you have static lines. Dynamic lines are the ones that you make just when you're animating. So you're scowling at somebody, you're raising your brows, or you're doing whatever. And that expression is showing those lines. And then when you stop making them, your face goes back to, like, if you're asleep and you're in repose, it's a beautiful, angelic little face. But you keep doing that, repeat it and repeat it. And eventually those dynamic lines become static lines. So they're etched in. You could be in a coma and you would still have those 11s. That's what happens.
Fascinating.
So that's why getting to them before, if you could stop yourself from making that face, that would be great. But who can do that? No,
Right.
like people always make you either raise your brows or go like this.
Yeah.
So you can, and if you could, great. But most people can't. So the alternative is to start interventions before they become a problem.
I remember when years ago, like when we were both at the spa, I would be signing off a chart and be like, what the heck is this person doing getting Botox at
30 or 28.
30?
Yeah.
And then I was like, wow,
There's logic to it.
something.
Yeah.
Yeah.
I know.
Yeah.
Because you wait until you're in your 40s and the lines are already etched in now, and it's much harder to undo that damage.
Can you explain what is Botox?
Sure.
Like,
When I say Botox, I literally mean there's 7 on the market in the U.S. That are FDA approved, but they're some form of botulinum toxin, hence the name Botox. And they're all botulinum toxin type A, and I won't even get into them. But when I say Botox, that's what I mean. It's very, very potent toxin that, if ingested, will kill you because it paralyzes the muscles. So if you have it systemically, it's a problem. But we inject it into very localized muscles and stop that muscle from contracting so that you can't scowl or raise your brows or squint your eyes or those kinds of things.
Yeah.
So when injected into those muscles for a certain amount of time, the nerve in the muscle can't communicate and you can't make those faces. And it lasts about 3 months. There are 3 on-label places you can inject them here: the 11s, your glabella, your forehead, which is like the horizontal lines, your crow's feet, But then there's a million other places we can do them. Yep, the chin, the depressor,
yeah.
these here. So I can't do it so good right now, but if you can show the bottom teeth like this, and there's a little pucker right here, that's a muscle that we can inject. If you pout like a baby and you put your chin out like that, and you get this rough orange peel like looking chin,
I just realized I have.
that is another place you can inject. The lip lines, if you purse your lips and you get some lines around here, we can soften those. You can actually get what's called a lip flip, where it just softens that downward and inward turn of the lip. If when you smile, you can see all of your teeth, like, you know, a real gummy smile. And you know, teeth are a beautiful thing, but sometimes it is distracting. So you can just do a little bit right here and it just calms that down, and you still have your beautiful smile, can see all your teeth. These things, they call them bunny lines. The big one lately is the Nefertiti lift. It's along the jawline in these platysmal bands, these things right here. They go up and over the jawline. Their whole job is to pull down. And if we can inject that and it just gives a little bit softer, it will sharpen your jawline, give you a little lift to your cheek. So that's another.
So
And then there's
cool.
Are you making a list of things?
of all the places, right?
Yeah.
What about filler? Can you talk about filler? And one thing I love, I love everything you do, but I love that you have a few core things that you stick with.
Yeah.
And you're not doing like 6,000 offerings. Like I love that you really focus.
Well, I'm, find one thing and be really good at it kind of thing, right?
Yeah,
So
and I
that's
love
what I
that.
started with was Botox and filler, and then I just have a few adjunctive things.
Yeah.
Filler is not quite as popular as it used to be.
Okay.
And probably for a good reason, because it used to sort of be they would just shove as much filler in your face at one time as they could, bottom line being money. And that's never how I've operated. Now they're leaning more into regenerative stuff, which we can talk about. But filler, most of the fillers on the market are made of hyaluronic acid, which is just a gel that attracts water to itself. And by doing so, plumps things up. Lip filler, cheek filler, you can look at nasolabial folds, marionette lines, jaw lines, stuff like that. Again, very different from Botox because Botox stops the muscles from moving. So if you have somebody, though, that when they smile, right, they're like, look, I have all these lines on the sides of my face. Well, you don't want to Botox that because then you can't smile and that would look awkward and no one wants that. So what do? You can do a little bit of filler into those lines, very superficial. Or what I would prefer to see is what I'm talking about, this regenerative medicine type stuff, where it is rebuilding collagen and elastin, because that's really what's happening is, yes, the muscles are contracting, but it's the skin that's buckling, right? Because it doesn't have what it takes to bounce back to where it used to be. So you end up with these lines on the sides of your cheek, all these other lines that we're talking about. It's because you're losing collagen and elastin. So how do we get that back? Right. And that's, people are like, oh, I'll take a supplement and they do whatever, but it breaks down a lot of times to just protein. So it's not my recommended way of getting your collagen back. I would say do a collagen induction treatment, whether that's microneedling, radiofrequency microneedling, Sculptra, which is it's called L-polylactic acid, I can't say it, or hyperdilute radiesse. All these things basically work on a type of cell called a fibroblast, which is responsible for making collagen. And if we can stimulate that fibroblast to kind of get back to work, you can increase your collagen. And that will improve when you pick at someone's skin, you can tell who's got like good collagen, versus my 91-year-old mom. Yes, you have good collagen. When I go like that to my mom, her skin is thin and friable, and it's much easier to just pick it away from the face. So regenerative is the way. Oh, and then PRP, PRF, those are great treatments too. Yes. Platelet-rich plasma or platelet-rich fibrin. Both and I love these personally because there is no foreign product.
It's your own
body, using your own healing mechanism. So I take the person's blood, spin it down in a centrifuge, and literally I do PRF, which is the fibrin, one of the two. There's no clotting or anticoagulant in the tube, so it will turn to a gel pretty quickly. So you got to work fairly quickly with it. But basically, you're just taking that and you're using a cannula, which looks like a scary needle, but there's no tip on the end. So you have to make a little hole in the skin and then just thread this PRF into the tissue. But that is loaded with all your growth factors, your stem cells, all the stuff that you want. And when you spin it in the centrifuge, you end up with your red cells and then your plasma on the top. I don't want the red cells. They're good for a lot of things, but not for this. So I draw off just the plasma and then re-inject that into the tissue to help with collagen production. And you can do it it causes collagenesis and neovascularization. So it's going to make new blood flow and new collagen so we can stimulate the follicles to start producing.
Huge.
Yeah,
Ladies,
which a lot
take
of
note
women.
of that one because there is a lot of hair
loss.
thinning
Yes.
that comes
Yes,
with
with
menopause.
menopause.
Yes.
And I've seen some good results, like from people that you've seen.
Yeah. It's a wonderful treatment. And anytime you're talking about collagen or follicles or any of these things, the bio revitalization, it's not a one and done. Filler's great because your results are instant. You see them and you're like, oh, I have cheeks again now, or whatever it is, or I have lips or whatever. That's great. You walk out of there, there's some swelling, so you look a little more dramatic, and then usually, you kind of, and some people go, oh, I wish I looked like I did when I left your office. But collagen, anything we're talking about, these treatments, they are 1 a month for 3 or 4 months. Because collagen production is not an instant gratification. So you have to wait. And the results that you're going to see are probably a good 6 months out from your first treatment. So that's why it's not like, oh, I can't, it's harder for people to really see that bang for their buck. But then I do show them, this is your patient picture when you first came in versus now a year later. And they're like, oh my gosh, I really
They can really
do look
notice
better.
the difference.
Wow.
And again, not like weirdly full and puffy faces or that pillow face, or they don't look so unlike themselves. They just look refreshed. And that's always my goal.
That's what I love too about your practice. So like looking through pictures and signing off charts, and I'm like, oh my gosh, like these women just look refreshed.
Yeah, they had a nap.
They
Had a
just
good
look
nap or maybe
refreshed.
vacation.
They don't look like they're on like Real Housewives of
No.
Yes.
which is not who you attract to your practice.
Yes.
No. And I don't, my patients are like 40 to, I have lots of 70-year-olds.
Yeah.
And they are my billboard, right? If they're walking around looking weird with like maleficent cheekbones or crazy Russian lips or whatever it is, and somebody says, oh, where did you go? And they say, oh, I went to Refined Beauty. And that's me. I am Refined Beauty. We're one and the same. And I don't want that. So
No,
I don't like
absolutely not.
people looking weird out there.
I tried. So Maya went with me one day. It's like, here, I'm going to do this treatment. So she did a treatment with microneedling and put salmon sperm right on my face. I'm admitting that. I hope my husband doesn't listen to this one. Because I did not tell him.
Salmon and no other kind.
I was like, I don't know that
something about Mary.
I've never told him that. So hopefully we'll have to skip this episode.
Yeah, we can cut that right out.
Talk about who's not a candidate. So if is there like any contraindications, for example, for Botox or
Oh, yeah, for sure. And that, is for me, a hallmark of a good provider. There are certain contraindications. And if you don't get asked certain questions, if you go because you had a Groupon and it was, $8 a unit, please, that's a red flag. Be careful. Yeah. These are potentially lethal medications. And if they're buying them not from their pharmaceutical companies or whatever.
The back of a truck or something,
it's sketch, right? So you want to make sure that your provider, exactly. You want to have the provider who has been educated and is taking the time to screen their patients or whatever, and has someone who is checking off and making sure that that's all good, as well as buying legit product.
Right.
So there are certain neurological complications or syndromes that people have. That's a hard and fast no. Like if I ask you, and there's crazy long names, and so usually when I say, I'm going to ask you if you have any of these things, and if you don't know what I'm talking about, it's a very good chance that you don't have it. But I will ask anyway. Pregnant, breastfeeding, there's certain medications people can't be on. So make sure that if you are seeing somebody, that you have been properly vetted as a good candidate for these treatments.
Yeah.
Love that.
Yeah.
Question, skincare. So, again, we're trying to just give information about all kinds of things out there. And some people are like, this is just not for me for whatever reason.
No, yeah.
So for middle-aged women thinking about their skin, what are your recommendations? I know what one of them certainly is. What is your license plate?
So I have it's a very old beater convertible. The top doesn't even go up, but the license plate is wear SPF.
So we know that's in there for
Yes.
sure. Not crazy expensive.
Yeah, no.
Can women do?
I always say that too. And if you come to me and you're like, I'm going to start over and turn a new leaf and I'm going to start doing skincare, and you normally do nothing, then we're going to start real simple because it can get overwhelming. These women with their 7 steps and all that other stuff.
Yeah, no.
Wash your face. That's just, and I don't care what you use. It doesn't have to be a fancy cleanser, CeraVe, Cetaphil, whatever, Neutrogena, I don't care. Whatever you want. Just wash your face, especially at night. More importantly at night than during the, first thing in the morning. The daytime, all the grime and the, all that stuff. Makeup, if you're a big makeup wearer, get it all off before you go to bed. If you have a clean pillowcase and a clean face when you went to bed, when you wake up in the morning, it shouldn't be that big of a deal. But again, now that's step 2, wash face in the morning as well. I don't really even care about toners. Skip them, have them. I don't care. It doesn't matter. If you can do nothing else other than wash your face, brush your teeth, wear sunscreen. Like that's a non-negotiable. Every day, I don't care if it's raining. I don't care if it's winter. Doesn't matter.
Right.
So if you must, and you're like, oh, I can't, whatever, pick a tinted one so that it's part of your routine. So that's the first non-negotiable for me. Second one, if you really, now you want to step it up a notch and you want to add something in, the next two best things with irrefutable proof are retinol and vitamin C.
Yes.
So retinol is going to help with those fine lines and wrinkles. It increases skin cell turnover. So again, a wonderful thing. Some people can't tolerate it every day.
Yeah, I was going to say for some people, it's,
So mix it with a moisturizer or do it every other day. Start from out to in because this is obviously, these areas are more sensitive. Vitamin C is great for pigment and it helps brighten everything. So those are the three things that I would say, everybody can find some product within all the different price ranges that will work for them.
Yep.
Now, if you really want the icing on the cake and you want to take it, to the next level, any sort of growth factor, these serums with peptides, growth factors, stem cells, any of that stuff.
okay.
Those are expensive.
Yeah.
I'm not gonna lie, but that is like I said, that's the pinnacle of there's all kinds of other things you can use and whatever, but definitely SPF, vitamin C, and retinol. And then if you can get
Retinol when? Night or day?
Night.
Okay,
Yeah,
nighttime.
yeah.
How many days a week? Every
if you
night
can
or?
do it every night, great.
Okay.
But you'll find too that as your hormones shift and everything, you might not need it every day. That's what I wanted to ask you about. What are your thoughts on estrogen?
Oh, for the face?
For the face.
Oh,
Yeah.
I'm using it.
Yeah.
And I'm a year
Yeah.
and a half in.
Yeah.
I think it's great.
And what kind of estrogen are you using? Did you just
Estradiol,
Okay.
prescription strength.
That's
Yeah.
but it's not a face cream. This is what I'm
It is
getting.
a face cream.
Oh, you're using the one that is
You can get the
actual
one
face
like
cream.
through the online pharmacies where you get the
Yes.
estriol cream. You can get them through compounding pharmacies. I'm going to be so honest. You can also
Use your vaginal.
That's what I was gonna. That's what I was getting
mix
at.
it
I was
in
like,
Yeah,
use
you
your
can.
vaginal
Yep.
estrogen, make a little
and
dot
you don't
of it,
have
mix
to
it with
do
your
it
moisturizer.
every day. Just
No, a couple times a
little
week.
pump
Yep.
once,
Yep.
twice a week
And
with your moisturizer.
To be honest, whatever's left on my hands,
do it everywhere.
I put it because this sort of area of crepey skin,
Yep.
I'm like,
The
can't
tops of your
hurt.
knees.
Yep. I don't waste any of that stuff.
Dive into a vat of estrogen.
I feel like for me, all of the other things I do for my face have been better as a result of doing the estradiol on my face.
Yeah.
Does that make any sense?
Oh, yeah.
My moisturizer works better.
Absolutely.
My
So with makeup, what causes the dewy? Now, I will say, I had somebody come in and I'm like, I've never looked dewy. But like somebody literally came into my office recently and I was like,
What do you
did you
have on?
dive into a like vat of like Vaseline? Like she looks slippery. I don't know.
Like a good look or not? Like,
Well, I think it maybe was a little far for me, but like in general, like
I
you know what
agree.
mean?
There is
that
a
weird video
glowy-
that we had that time. Remember, there was a video that we did that we had to get rid of.
Oh, yeah.
For whatever happened,
I
Vicky
don't know
looked like
what
she
I
had
had on my
Vaseline
face.
on her
Yeah,
face,
I
but it
did.
was
I was like-
bizarre.
I
we
dove
we
into
dumped
a
it.
vat
It was
of
funny.
Crisco.
It
Salmon
was
sperm.
funny. It was funny.
Oh, maybe it was after
Maybe
my
it was after
salmon
that.
sperm. I love it.
Yeah, I don't a big makeup wear. I have, a little bronzer once in a while, but that's about it.
What should people look for? And so they're saying, I think I want to dive in and try some things for myself. What should they look for in a reputable, like great place to go for a med spa?
So aesthetics is a weird industry in terms of medicine because there's no course of study to become certified or a master injector. Those are all just BS terms. There's nothing to it. I am a nurse and you are a nurse practitioner and you could do a 1-day course and be like, I'm a certified, lunatic.
Right.
No, you're certified injector. It's very
actually,
scary.
yeah.
So you need to do a little deep digging and you need to ask them, how long have you been doing this? What services do you offer? Do you offer everything from GLP-1s for weight loss, hormones, and, Botox and fillers? Or do you just focus on your little, lane? And that I turf everything to you for the other stuff because I have to spend thousands and thousands of dollars of my own money on education every year. I can't be affording to go to other types of, conferences and trainings or whatever. I'll stick to the ones I know. I'm going next week. I'm going to Chicago. So that's it. Another piece of it is continuing education. What are these people doing to ensure that they are staying abreast of what's new, what's effective, what's safe? There's big turmoil in the aesthetics world right now about this stuff called PDGF, which is platelet-derived growth factor. And It's commonly used in wound care and in oral maxillofacial, dental implants and stuff like this. But now they're trying to bring it into the aesthetics world. But it does not have FDA approval to be injected into the face. People are using it for tear troughs, for hair, all these other places, but it's not approved. It's not just off-label. It is literally says on the syringe, do not inject. So is your provider doing that? And if so, did they take a class? How do they know how to do this? And is your malpractice insurance, are they covered? If something bad happens to you, what are they going to be able to do to fix it for you? Is there a reversal agent? So there's a lot that goes into it. A lot of red flags in terms of, these chain med spas. Who are these? There's nurses that get out, they get into nursing specifically to become an aesthetic injector. I mean, I'm all for educating and all this, but these young girls, they don't know how to see a patient even yet. They don't know people. They don't know systems. They don't know, I can spot a red flag, an eating disorder or body dysmorphic disorder, these things, because I've been a nurse for a long time. Absolutely. I know how to read people. They're young. They don't know anything. And they're like, oh, I'm going to be a nurse injector. And I'm like, that's great. And you're beautiful, but
get a few years under your belt of traditional, and that's
these chains and these, that's who they're hiring, these young girls, because the other ones are like, they know their worth, and they're like, I'm not gonna work for that because I'm, So it's tough. It's an interesting industry, and it's actually, I just read something the other day, and they're like, we shouldn't even be calling it an industry. It's a medical specialty. Yeah. It is what it is. It's not like a.
Yeah, I mean, I sort of feel like you're getting things injected into you, right?
And they have complications.
Correct. Like I would feel like, at least for me, I took recommendations from Vicky to find you. Yeah. I would rather go someplace that I know somebody else that's very scholarly in particular goes to. Like I would never just pick something off of Instagram, right? A Groupon. Like,
no, I know.
Yeah, no. So I think doing your due diligence and vetting people and reading the reviews if they're there, do all of that stuff. There is ways of figuring it out. And
as I don't have a ton of reviews. Again, you were talking about the stigma of aesthetics, and it still is. New England is very uptight. We are what we are. We're Yankees and whatever. Although it's becoming more common, people still are, they're not even gatekeeping. They just don't want anyone to know their business, that they get Botox, or they get, any of these procedures done. Whereas if you were to go out west or down south, oh my gosh, every other corner, they're like, oh, who does your Botox? It's like whatever. Not in New England. They're like, oh, did you do something? And, so it's hard to get these reviews, but the ones that I do have are all, I cherish them because that is how I get my patients, is word of mouth. I don't think that any other way is really.
Yeah. And the purpose of our podcast is to provide information to women so they can make choices for themselves and to bring things to the front, right? There's been too much not talking about women's health care and looking after women.
And also, I think we need to take shame away from so many things.
Absolutely.
Again, I was talking about the spectrum, and I find myself, sort of in the middle, but I'm also you do you. You do what makes you happy. Yeah. You do what makes you feel comfortable without judgment from me. So again, if you want the big lips, you do the whole thing, you do the whole thing. And if you want to do none of it, you do none of it. But, we deserve to do that without judgment.
Yes. I agree with the do none of it, do some of it, whatever. But I feel like as providers, we are doing some patients a disservice by not saying no.
Oh,
when they are like, I want another syringe.
Lips.
And I'm like, no.
Well, that's when you dive into some of the body dysmorphia stuff.
Yes.
Like, you're
never going to make them happy.
At this point in your career, walking red flag of somebody who is never going to be happy.
And I will say no.
Anything that you do and is going to want more and more because they don't see an accurate picture
you'll
of
never
themselves.
Satisfy them. And I would rather say no than say yes and have someone who's never. I would rather never treat you and have you be unhappy that I didn't treat you than treat you and you're never going to be happy.
It's interesting, and I can see how it could be a little bit not addictive or right, because even me, right? I'll look at what I've done and I'm like, I wonder if Megan can touch that up a little bit. And what if I do that? Like, is there anything we can do to right? So and then you go, all right, this is your face. Yeah, this is your face. This is it's a reflection of you. Yeah. We're not into not looking like you, right? So how do we make sure that we look like me, but still reflect? Yeah.
What I feel like on the inside, right back to what you said in the beginning, which I think is beautiful. Yeah, 100%.
And I'm honest about mine. When I tell my age to people. They're like, you're not. And I'm like, I am. I'm 60 years old. And they're like, oh my gosh, like you look so good. I'm like, well, I really do take care of myself. But
inside and out.
Yeah, but I do participate in a little bit of help too, right?
There's
and
no
I'm
shame in that.
And I'm okay with that.
Yeah.
Absolutely.
So my mother is almost 92, and she'll hear this and be mad at me. But, you know, when I do anything, like I had a blepharoplasty because Botox was never going to lift my eyelids. They were super heavy. And my mother's like, oh, I can't believe you're going to do that. She was like super mad about it. Like she thought it was, I don't know what she thought it was.
But that could be functional too, because it can affect your eye.
Yeah. But I always say, I'm like, Mom, what's the difference between you getting your hair blonde at 91 years old and me wanting to do a little Botox? I'm like, I don't need it. You don't need blonde hair. What's the difference? Right? You feel good about yourself when you look good. And why shouldn't I be allowed to do that same thing? So it's kind of
our mother's generation is really different about it. I remember when I would come home from working at the spa and my mom would always be like this. She'd be staring intently at my face. And the funny thing is, one time I come home, I was going through a divorce. I was like in the throes of like having a really terrible time. And one of the people that we work with was like, you just need some cheeks. I was like, hello. And I came home and I was like, oh no, my mom's there. She's going to notice. She goes, what did you do to your lips? And I had done nothing to my lips. They just have a different kind of perspective.
That's funny. Yeah. Truth be told, my mother would have been all over this. My mother would have loved all of this.
I think
right?
my mother now is like, ooh, maybe
my mother. I was the one at 13 that my mother like took in to have my eyebrows done. Wow. We had facials. Oh yeah, like she would have been. She would have been all over this. Like right? Yeah, I remember her wanting to bleach her teeth like in her 70s and stuff. Yeah, she had Alzheimer's, but still wanted to bleach her teeth. Yeah, right. Yeah, so my mother would have loved it. Isn't that funny? Yeah.
So last question. I'm so thankful that we had you here today. This was really fun.
Yeah.
How can people find you? That's important. So how can people find you to come see you?
Yep. So it is a pretty easy website. It's refinedbeautymedspa.com.
Perfect.
They can call the number is 603-718-1998. I'm right on Main Street in Nashua, not like the busy part of Main Street, sort of between Hayward's and City Hall. So it's a stretch of Main Street.
It's a beautiful office.
It's cute. It's again, reflects me, I think, in its a house from 1920 that's been converted into just a nail salon and my spa on the other side. Ample parking around back, very discreet. Nobody will know you're there. Those are the best ways to find me, or you can reach out to Vicki or Kim. They know how to find me too.
We have the number.
You know what we can do? Keegan, remind us, we will link.
Yeah, we'll link.
We'll link to your business at the end of the podcast.
That'd be cool. Thank you. I appreciate that. And again, word of mouth is not only is it my best referral option, but it gives me pride, I guess, because I know that you trusted me enough with your face and you're happy enough with it to say, hey, Vic, I got this girl, like whatever. So it makes me feel good that at least I know I'm making a difference in people's lives.
Oh, thank you.
Thanks for having me. I appreciate you guys more ways.
Yeah. Well, like as you learn more, maybe we'll have you come back in the future.
Talk about.
Yeah, we didn't talk about Sculptra. Well, I guess that's kind of right.
But we did talk about.
Yeah, so we'll talk about
more. Bring that up again.
What? And salmon spread.
Yeah, salmon spread. All right.
You and Kim Kardashian.
Yeah. Thank you, ladies, for joining us again.
Thanks for having me.
Yeah, this has been awesome. And remember, you get to take care of yourself inside and out, and you are worthy of nice things for yourself. We'll see you guys next time.
Bye.
Bye, friends.
Thanks.
Thanks for spending time with Vicki and I today on Faded to Fabulous, where midlife is just the beginning of your boldest chapter yet. If you got something out of today's episode, we'd love it if you'd share it with a friend and leave a review. Hit subscribe so you never miss an episode. And if you're looking for more support, inspiration, or sisterhood, come join us at fadedtofabulous.biz, because you were never meant to do midlife alone. Until next time, stay fabulous.